Ramsey's first diagnosis was a really low curve, like a 10-degree, but I knew to check it because I had scoliosis growing up, and the curves were high enough that when I did get checked, we went ahead and went through bracing. And at that time, it was like prior to everyone having internet, and so we didn't have any way to research like what other options we had. But I always felt that there had to be something more than just sitting in this brace, and it was a Boston at that time as well. So I already knew, what to look for from my own experience. And then my oldest daughter, we started seeing it in her when she was around 9 or 10.
Very often when I treat a child of a patient that has scoliosis, when the parents have scoliosis or when the siblings have scoliosis, the most common question I get asked is, of course, is this genetic? Is it just 100% genetic cause? And we know that this is not true, that they've done studies on identical twins and they found identical twins that share scoliosis. They only found that 60% of the time, and then they find identical twins that only one person has scoliosis and the other twin does not in 40%. So it's not 100% caused by genetics, but it is familiar, meaning that if somebody in the family has it, it's more than likely somebody else in the family may develop it, but it's not always given that. So if somebody in the family has it, you want to be more conscious of evaluating kids, especially during growth and development, because that's when it can happen. Unfortunately, it's also not related that if one has a very severe curve, the other is going to get a big curve. We don't know, but the more it does make sense that if somebody in the family has a significant size scoliosis, it'd be more likely that the other would develop that. So when we looked at Frances's curve and at her age and the size of curve that we have, and knowing that Trinity already had a significant scoliosis that was not being successfully treated with Boston bracing, we took this opportunity to reduce and manage her scoliosis as a sign to try to stop that progression to occur.
And started researching and found Scoli brace, and then started just with that, and then down the line through our chiropractor in Tallahassee found Dr. Nalda. The time frame for her progression from 10 degrees to 19, 20 degrees was about a year and a half. The treatment here is intense for the child. I mean, it's not physically painful. Not in that way, but it's a long day, and there's a lot of emotions that go with it as well. Just because you're asking your 13-year-old or whatever age they are to give up this, not just one day, but 5 days, and for some kids 2 weeks of their time, typically a vacation time as well. So it's a lot to ask, but they will explain it, adjust it, fix it, change it, whatever needs to be done.
Scoliosis is not an injury. And when we look at injury treatment, you want to treat it slow over a long time because you're helping patients recoup from an injury that they received, and you're helping their body go through a healing phase. In scoliosis, it's a progressive problem that rapidly accelerates during growth. So if you treat it long and slow while it's progressing rapidly, you're going to lose, and it's going to progress faster than you're actually trying to reduce it. In addition, scoliosis wants to rebound. It wants to go back to that position because it's a developmental problem. They're growing with it. It's not an injury-induced problem. They can't recover themselves, so you have to stabilize it during this progressive stage. If you have long treatment gaps, the curve regresses right back to where it was before you're reducing. So because of the rebound and the way it progresses, you must get ahead of the curve very quickly, and the only way to do that is with a high-dose short-term program to reduce it very, very quickly before it progresses, and to actually hold that reduction over time.
We are very pleased with the results. Ramsey's curves are not that big yet, starting at 20 degrees or slightly less than that. So from this week that we've been here, it's been reduced close to 50%. It's been about a 9-degree reduction in her curves. It is a big learning process. I feel like if I ask the question, it's respected and it's answered. So that's something I really appreciate. And that's something, again, I would encourage others to make sure that they're doing. Like, don't ever feel afraid or worried about asking whatever question or concern that you might have about the program or how it's working or what's not working for you.
Even though I would love to personally do every single piece of treatment for every single patient I see in my clinic, it would be virtually impossible because I would be able to see a very small number of people. And our goal is to prevent as many surgeries as possible. So therefore, my extension of me is my staff and my team. So I spend a lot of time training them to make sure they're providing the best care, the proper setups, because every setup and every care is unique to that person based upon their curve presentation. So a properly trained team and staff in delivering a very effective care is important. In addition, that they're important and to keep them motivated because the treatment is very repetitive. And this repetitive process over time is one of the key things to get a reduction. But for patients, it can be kind of boring. So therefore, my staff is trained to kind of keep things and spirits uplifted and trained to keep them motivated and keep going towards the end goal and getting a reduced curve, preventing surgery, and a positive outcome.
So if we can continue to keep that down with the bracing and the therapy, then we're good to go. That's the goal.